we're talking about 5 mistakes you don't want to make in psychotherapy. Now, you're not going to like any of these, and they're all important, but the last 2 have far-reaching consequences even outside of therapy if they're going on. They could affect happiness, the possibilities of connecting with others. So stay tuned. You don't want to miss the last 2 especially.
Absolutely. And so let's start with the first one, in terms of things that hold people back in therapy. Not attending sessions or not attending frequently enough. What do you notice about that in terms of people's progress?
Right. In all my years of practicing, people that come fairly regularly and consistently, I think, get the most out of it, right? Because if you spread it out too much, or you're just, not available, not present, you lose a lot of momentum. You lose kind of the points you were working on. So coming consistently, it's maybe seems elementary, but pretty important.
Absolutely. I think that's one you can really focus on to make sure you have more gains. I've noticed that often conversations will kind of end in one session, but then can be picked up in the next session. So
Right.
if there's too much time between that, it's hard to bridge the sessions as effectively.
And we do, take notes, but even with good notes, sometimes you miss something if there's too much time and space in between.
Right.
A certain tone or feel.
Exactly.
Or information even.
And I would just add, probably for most people, that frequency sweet spot is around once a week. Is that what you found as well?
Yeah, I think so too. And I would suggest for most things, not more than twice a month.
Right.
Or not less.
Not
less than
yeah,
twice a month.
That's true. Some people can start to space it out more depending on where they are in therapy. But more than that, like once every 3 weeks or 4 weeks, starts to become very sort of...
I would recommend, once every 3 weeks or once a month, only for like maintenance of some work that's already been pretty well established.
Right. Yeah, that's what I found as well. Well, how about the next thing that you notice holds people back in therapy?
Not doing therapy homework. So one place where I think a lot of people make some change or improvement in their lives is in understanding themselves and gaining some insight. But if that doesn't get translated into real behavioral change in their actual lives and in their actual relationships, it may kind of feel like a hollow victory. It may not have enough substance to it.
Yeah.
What are some of your other thoughts on this one?
Yeah, I agree completely. It's almost like... as understandable as it is, if you come to therapy and are just thinking that 1 hour each week is going to do all the work, it doesn't tend to be that way. Often we have to have an action step or something that you're focusing on changing or attempting between sessions and then reporting back on that to see what insights come from it.
Right. And so sometimes people come and they just like to be able to, get things off their chest or, express their emotions, and they do feel a little bit better. But that kind of therapy alone, if that's all we're doing, it may not yield lasting changes in the person's life.
Right. Exactly. So I always think when you're contemplating therapy, it's great to take as a given that will include not just the financial commitment or the time each week of seeing the therapist, but also what the person is willing to commit between the sessions. Yeah.
Right. And that can be just something as simple as noticing thoughts and emotions together, or it could be something bigger like facing a fear. Right.
Right. Exactly.
Okay, so number 3 on our list is not being completely honest or not letting yourself be vulnerable with your therapist. What are your thoughts on this one, Chris?
I mean, it's hard to do. I definitely have a lot of empathy. You're meeting someone and trying to take them into the most intimate details of your life. But sometimes I've noticed people can be hesitant to share things that feel shameful, or maybe that doesn't align with the image of themselves that they even want their therapist to be privy to.
Right.
But precisely that can kind of get in the way of this work going forward, right?
Right. And I do want to add that it can be normal for that to take a while as you're trying to, realize if you can trust your therapist, if you guys click well. But eventually you want to be able to kind of really bring the most pressing, issues and problems and emotions that you're having into therapy, or we're just not going to know. We're not going to be able to help you with it. Yeah.
And I would add one piece to that. Some clients are really good at kind of talking about an issue. So it's not like they're holding back the issue itself, but it's a little bit intellectual, kind of cognitive. They're not necessarily allowing themselves to be vulnerable on that emotional level and really feel that in session and kind of go to that deeper place. And I think that's crucial.
Yeah, I would agree. Okay, we're quickly approaching our last 2 here.
Yeah, so these are the last 2 where you were saying have a kind of impact beyond just the success of therapy, but even affecting how happy or meaningful our lives
Yeah,
are.
I
So
think so.
kind of a new level here. And I'll take the number 4, not taking responsibility. Where have you noticed this coming up in your work?
Sometimes what will bring a person into therapy is that they're having some difficult relationships, and they may really want to know how they can change the other people in their lives, right? What are the problems with that? Well, we don't have control over the behaviors of other people, right? And so focusing too much time on what other people are doing in your life to you or around you eventually becomes really kind of just futile. I think
Right.
we have to look at, if I'm the client, what is it that I can empower myself to change or do to make my life healthier?
That's really well put. And I feel like another angle on that is being able to acknowledge the role that we're playing in kind of creating our circumstances. And I want to be careful here, not wanting to place blame. Things really do happen to people. They're not their fault. But we
Right.
all have some capacity to kind of work with those conditions
Right.
and at least make them a little better.
Right.
And that does require taking on the responsibility of saying, okay, there's something I'm doing that is perhaps
Right.
shaping my experience, and I could work on kind of confronting that directly and getting a better result.
Right. If I'm noticing a pattern, I keep having this kind of dynamic or interaction in my relationships, and I'm the common denominator, I might want to look at maybe I'm doing something, that's really not working.
Exactly, where you're not just 100%
Right.
a victim of circumstances,
Right.
but there's something there that you could work on to maybe shift that in a positive direction.
And while that's scary, it's also empowering because then you have something you could work on to really yield possibly some fantastic change.
Exactly. It's almost like taking responsibility is the price of admission, but then there's this big gain where you can actually notice some things shifting in a positive direction that wasn't possible before.
Right, exactly. Yeah. Number 5, not willing to risk change.
Yeah,
Oh,
big one, right?
This is a big one, right? Because
Yeah.
change is scary and hard. We often don't make big changes until we're really uncomfortable, right?
Yeah.
What do you think? What else gets in people's way?
Yeah, I mean, I think it's easy to enter therapy, understandably, just wanting symptom reduction. But often, where I feel like this work invites people to go is acknowledging that often they do have to change their lives, their work
thought
situations,
processes,
their thoughts, maybe their relationships, their self-identity, how they see themselves. And that is very hard. And we tend to shy away from that deeper work, right?
Right. But if you want real lasting change, that might be where it really needs to go.
Yeah,
really
absolutely.
Risking a big thing.
And I think therapy at its best is this sort of invitation to really contemplate permanently making changes to put your life on a better course. But it does ask a lot of people, if we're honest, and it's something we can easily try to skirt around.
Yeah, there's 3 A's that we had talked about. People have to tolerate or experience when they're making these big changes: anxiety, ambivalence, and ambiguity.
Right? I love that. And that's from Jungian psychologist James Hollis. And he talks about that as kind of where we kind of have to grow up using therapy as a support to get better at those 3 A's. And I love that. I think that's a helpful way of characterizing it.
So in other words, life is scary. And we all feel that at times. But can we show up for the challenges and make the changes that we need to make?
Absolutely. Yeah. Well, those are great. I hope you enjoyed these 5 tips for making more progress in therapy and also just having more life happiness and enjoyment.
Yeah. And if you'd like to hear more on this topic, comment below. We could do another show on it or another segment because we've got more ideas. And we hope you're enjoying our show, and subscribe.
Thanks for watching.